Good morning, everyone. Today is Thursday, August 3rd. Thank you so much for joining into our weekly HCR webinars. Hopefully you find them informative. I can tell you that I do feel like I'm in a constant game of whack-a-mole lately with all of the rapid changes with proposed bills going through, etc. So it is getting a little bit crazy out there, but hopefully, again, you find these helpful, these webinars helpful, that you can kind of weed through the crap, basically. So I'd be remiss if I did not introduce myself. My name is Deb Wilkinson. I'm the Vice President of the Health Plan Options Department here at URL. And, these webinars were started 4 years ago, believe it or not, to have a way to better communicate with my agent partners, but also be a resource to get the questions answered. Because if you think about it, 4 short years ago, we were brand new to the ACA and had no idea what healthcare.gov would do or could do. So we as a team have been through a lot, and I think there's a lot ahead of us with anything that will come out of Washington. So let's just jump right into it. If you are new to the format, you can ask questions by either raising your hand on the control panel to the right of your screen. There's a little hand icon, or you can type questions into the question box, and I'll answer those at the end of the webinar. Just with a show of hands, if you can just let me know if you can see my screen, that is excellent. Hopefully you can all hear me as well. So let's just jump right into it. We did not meet last week, but we did talk about the Healthcare Freedom Act, which was the skinny repeal that was voted on last Tuesday, and of course it was not passed. It was a crappy bill anyway. I'm not sure what the GOP is thinking. They've had certainly 7 years to digest what the ACA is or isn't and come up with a plan. But, from my perspective, in my personal opinion, it seems like they're just renaming some of the provisions within the ACA and throwing more money at it and hoping that it resolves some of the issues. But, again, the HCFA did not pass. So what is next? Well, if you listen to Senate Majority Leader Mitch McConnell, there's nothing. They're moving on. Senator Rand Paul had a proposal, met with the president, I believe, for lunch, they say, the news says, and discussed offering association plans. And they feel that can be done very quickly with an executive order. Of course, we all know executive orders are just as easy to remove as they are to put in place. Also, I think anyone that has been around the block a while in this health insurance industry understands that association plans are good at the beginning, but just like all group plans, the risk pool gets sick and the healthy ones leave and the sick ones stay, and it blows up. So I'm not sure that that's the solution. And then Senator Lindsey Graham, this one seems to have the most teeth to it. He's suggesting that all of the ACA appropriations, the money that is held up in the federal government, be released as block grants to the states so that states could essentially do what they feel is best for their citizens. So, that one seems to have a lot of teeth, like I mentioned. So it'll be interesting to see what happens for Pennsylvania. That's probably not going to be a big transition from the provisions with the ACA because of our state makeup. But, again, it could be something. There's also talk about removing the congressional staff subsidies. They pay about 72% of premiums. I think that might be the best thing, that if they remove those subsidies and everybody has to deal with the full price, then maybe something will change more quickly than it has. There's also talk about discontinuing those cost share reductions. We've talked about this before, where this is the one that the insurance carriers are really just getting very uneasy about, because every month the administration essentially hangs the cost share reductions over the insurers' heads, and it's hard for the insurance carriers to plan. Now, I'm not crying for any insurance carrier. I'm just saying it's hard for them to plan and price appropriately. So that one can be done, but will it? I don't know. You know, we've talked about it before, and it could raise premiums in Pennsylvania, you know, 20 to 25%. So again, I'm not sure that that's the solution. There was a procedural decision Tuesday where the judges say that states could actually, if the cost share reductions were removed, states could actually sue the government for those subsidies. So again, you know, I put a picture of whack-a-mole because it just seems no matter where you turn, you know, you're trying to hit the right mole, I suppose, and it's an impossible feat. The latest news is that the Democrats are now also working to fix the ACA. Some of the provisions that I'm reading, the Democrats are talking about codifying the cost share reduction payments, lowering the cost of prescription drugs, and strengthening consumer protections to ensure premium increases are stabilized. Of course, those are all lofty goals, but just that, you know, where's the real meat in the bones that there's a plan in order to do this. Another Democratic proposal, it would allow people ages 50 to 64 to buy into Medicare. Again, this is all just talk. Nothing has been proposed yet, but it does look like the Democrats will get to work on doing something. There are staffers from both the Congressional Progressive Caucus and the Congressional Black Caucus that are wanting to expand community health centers. So again, those are some of the Democratic proposals. Will they stick? I don't know. But again, we're back to the game of whack-a-mole, and unfortunately, the instability of the market going into open enrollment for the under 65 market for 2018. So it's going to get a little crazier, I think. So in case you are still a glutton for punishment, the 2018 FFM certification is now loaded on the portal.cms.gov. In your handouts, I did include the guides for going in and getting certified if you are returning, you know, you've certified last year, or if you are new. So those are included in your handouts. And I also included the Privacy Appendix A and Privacy Appendix B, just for your reference. You can either, you know, of course, print that out from your handout, or if you want to email me, I can get you any of these items in PDF through the email. But I did want to just show you one thing. If you are, oops, let me go back. I apologize. If you are returning, you can just the individual 2018 refresher course is automatically going to be loaded. It's odd this year that it's not, you know, modules 1 through 11. It's kind of haphazard in how they load it. So some things show in progress versus launch, but you are able to get through it. This screen is showing you that, once again, for 2018, the only requirement for SHOP is this privacy agreement. So all of these other things are optional. If you, again, want to be a glutton for punishment, you can go ahead and do the whole SHOP module, but the SHOP agreement is the only thing needed. So just keep that in mind. And let's see what else I have for you. We're still having some issues on the CBC end, Capital Blue Cross. There's still problems with the renewals. They're not attached to, the renewals are not attached to a specific agent, some of them haphazardly. So if you have not received your 11-1 renewals, please contact your new business specialist, and they will get those for you. You know, again, we try to get them out as soon as possible. They are now emailed from Capital directly to the client, and it's just really been a nightmare on trying to get these done when everything is missing. So we're still working with Capital, trying to get the systems fixed, but again, we're at the mercy of their systems. August 16th, from 8 to 11:30, CPAHU has a 2 CE seminar. So I would encourage you to register for that. It is being held here at URL, and the topics are Self-Funding 101 and ERISA. So definitely topics that would be helpful going into fourth quarter. I'm also holding a seminar on August 23rd, also here at URL, and that is 2 CEs as well, and that is top 10 items to review for healthcare reform compliance. Again, very timely going into your group renewals for fourth quarter. So please, when you get my newsletter in a few minutes, take some time and register if you have an interest in attending either of these seminars. Our Medicare Connections seminar, which is at the Hershey Lodge, that is September 6th. There's still some seats available for that. And our Leaders Conference, which is the next day, September 7th, that format has been changed a little bit, but it is still being held, obviously. We just thought with the 2 days back-to-back, it was a little bit too much. So we've condensed the Leaders Conference into a morning-only event. We'll have breakfast, we'll have the breakout sessions, and then we'll have lunch. And then the program will be over. So rather than holding you for 2 days in a busy time of year, it is going to be a full day for Medicare Connections on September 6th and a half day closing after lunch on the 7th for the Leaders Conference. That information is also in my newsletter. Please take some time to register. I have Geisinger, Capital, and Highmark coming. You can register for one of those breakout sessions, with each of them, and ask them those difficult questions. And my instructions to them are to talk about their 2018 strategies. I don't want to know products per se. I want everyone to have an idea of what the carriers intend to do, both on the individual side, the group side, and as far as commissions go, and what their strategy is based on some of the proposed changes that may be coming up towards the end of the year through Washington. So again, I think if you, have some time and that is an interest to you, please take some time to register. One of our agency partners in Carlisle is expanding their Medicare sales and would be interested in talking to anyone that is interested in a Medicare sales position at their agency. So if you have an interest, just give me a call. I can get you the information. Let's see what else I have on the agenda. Oh, one item backing up to the certification. They are changing the age bands this year on the individuals. Before it was 0 to 18, then 19, or 0 to 19, I believe, and then, 19 plus. Now it is one age band for individuals 0 to 14, another for 15 to 63, and then one age band for 64 and older. So, again, I don't know what that will do as far as the rates, getting them lower for younger folks. I don't know. We'll find out very shortly. And last but not least, I did want to talk about our quoting portal. We have just started using Benefix, which is a company local to Pennsylvania. It's in Lancaster, but they are national. They are young and bright, and this system is second to none. They are, if you are using URL for your quotes, you will receive the Benefix quotes, and I have an example here for you. If you have purchased a license for the Benefix portal, all of the rates for fourth quarter are loaded except for Geisinger, and they should be loaded hopefully by tomorrow. So, again, that's certainly an advantage, but the format itself is great. You can click on PDF and view the SBCs or the summaries. So again, I think it's a really great system. It's quick, and with URL, if you are interested in purchasing this system, again, you don't have to. We will do all your quotes, but if you want to have the ability to, to tweak quotes and play around with it, we are offering this system. You can buy a license for $250 a year. So if you have an interest, please reach out to me, and I can get you in touch with, you know, who you need to get in touch with. So let's back up here to our agenda, and that opens it up for our open forum. So let's just see how many questions we have today. Not many. The old question that I can never answer. Dave asks, any idea about 2018 commissions for renewal and or new individual plans? Dave, I have no idea. I do know that the carriers, HHS has said that if the carriers file for commissions, they have to pay same commissions on as off. They can't pay more for some metal levels versus others. And if they decide to pay commissions, they have to pay throughout the whole year, not back out in the SEP period. So that's certainly an approval. And Scott asks if I can elaborate a little more on the congressional staff subsidies. Yeah, way back when the law was signed, actually even before the law was signed, they disallowed the congressional staff from getting into like the federal employees health benefit plan or something. You know, I'm not sure of the exact name of it, but essentially what that meant is that they were getting subsidies. So, you know, again, it's about 72%. I can get you some more details. Obviously, I'm not a pro on this particular topic, just know enough to be dangerous. But I know at the time it was pretty controversial on why congressional staff was allowed to have subsidies when, you know, others that had employer-sponsored coverage could not. But again, it's something that is being looked at. And again, I think it might have the biggest effect on getting anything changed on the ACA. And that takes us up to the end. We have no more questions. As always, I truly appreciate everyone joining in. If you have questions on anything we discussed or need any of these handouts, I'd be happy to get those to you. And just as an FYI, please remember that when I talk about the certification for 2018 and the privacy agreements, et cetera, that is specific to the under 65 market. The Medicare certifications and AHIP and all of the stuff for the 65 plus is going on now. And if you need additional information from the Medicare offerings team, just let me know and I can get you in touch with them as well. Because they have some items that will help you when you are certifying. So that brings us up to the end of the webinar for today. Hopefully you'll join us back here next Thursday, August 10th. And as always, I truly appreciate everyone joining in. Keep your questions coming. We'll keep in touch with Washington and see what is coming out in their newest game of whack-a-mole. Enjoy the rest of your week, and please enjoy your weekend. Bye-bye.